Hello all, very good morning. In today's topic, I would like to discuss you regarding the disease condition obesity. So coming to the topic here, if you see this obesity, it was one of the major problem which is present all over the world. It is not pertaining to a particular area or particular country. This is present all over the world because of the dietary habits which were followed in today's world, and because of the inactivity and because of the lack of exercises, it is resulting in the condition obesity, which is becoming a major risk factor for so many diseases and causing the increase in mortality as well as morbidity rates. So coming to the introductory part here, as I said, this was one of the most common frustrating disorder. So what is this obesity means? Excess of the adipose tissue. So the adipose tissue is becoming more than it is required by the body. So what is this overweight means? So whenever a person is having excess weight according to the age or height or sexes. For example, if you see, if an adult, when you take an adult who is at the age of like 20 to 25 years, the average weight it should be like 70 to 75 kgs. But if you see in this case, the person is weighing like 85 kgs, 90 kgs, 100 kgs or even more. So according to the height of the person, according to the age of the person, and according to the sex of the person, the height is defined here or the weight is defined here. So beyond that, beyond the weight of average weight of a person, it is termed as overweight. Coming to the prevalence rate, if you see in adults all over the world, about 20 to 40% of the adults are having this obesity problem, and in children about 10 to 20% are having this obesity problem. Coming to the country India, if you see, 61% of the population are in obesity stage. So coming to the definition here, so what is this definition means? Obesity, it is defined as an abnormal growth of adipose tissue due to the enlargement of fat cell size or an increase in the fat cell number or even both. So obesity, it is always expressed in the means of BMI, nothing but body mass index. So if you see the enlargement of the fat cell or the increase in the number of the fat cell, it is causing the obesity here. So if you see the types of obesity, we have hypertrophic, we have hyperplastic, and we have both the obese. So first we will see what is this hyperplasia. So here the number of fat cells are increasing. What it is increasing? The adipose tissue is increasing because of the number of adipocytes are increasing here. Coming to the hypertrophic, here the number of adipocytes are like lesser in number, but the adipocyte which is present, it is increasing in its size. It is increasing in its size in a means it is not increasing in numerous way, but it is increasing in the size. Here if you see if in hyperplasia, they are increasing in number. They are increasing in number, but here it is increasing in size. So if you see the combined type of obesity, both they will increase in number and they will increase in the size of the adipocyte. So these are some of the types of obesity. We have hypertrophic, we have hyperplastic, and we have both, means combined. So what are the epidemiological factors we'll see here. So if you see the cause of the obesity, it is very difficult to diagnose because there are multifactorial multi-factors which are causing to this obesity. We have genetic factors. So coming to the genetic factor here, if you see persons who are genetically, means if their parents are having obesity or if their grandparents are having obesity, it was observed that about 50 to 90% of the people, they are getting the obesity. So if you see the normal gene which produce leptin, it is mainly controlling the appetite. So in some of the people it is very less, which is leading to the decrease in the control over the appetite, and it is increasing the weight of the person. And if you see here, when two identical twins are born, so if you see here, there is a close cut relation between them. If one person is getting obese, automatically the other person is also getting obese. So coming to the age here, so obesity, it increases as the children, as they are growing, as the children, as an adults also, the obesity is kept on increasing. And here if you see, they have more number of adipose cells than the normal. So what is this obesity? Having more number of cells than required by the body, more number of adipose cells in the body, it is leading to the disease condition which is called as obesity. So if you see the sex here, so men are found to gain most weight at the ages of 30 to 35. So if you see here in men, 30 to 35 is the ideal weight to gain the weight, and if you see the woman, 40 to 45 years is the ideal weight to gain the weight. If you see the physical inactivity, so because of physical inactivity, it is mainly causing it is restricting the person to go and play. So if a person is not going and playing outside, if a child is not going and playing outside, if a child is continuously sitting, or if an adult is continuously sitting, it is increasing the adipose tissue in the body. Again, there is resulting in the physical inactivity. So it has become a cycle. So when a person is becoming obese, he is unable to do his things on his own, means he is unable to play outside. His physical activity is very limited, which in return it is restricting the activity. Again, when a person is having restricted activity, it is leading to the obesity condition. So next thing is socioeconomic status. So if you see in India, obesity is more common in some groups based on their sources and their food habits. So if you see, there is a clear relationship between the socioeconomic status and obesity. So the persons who are having a very rich dietary habits, those persons, they are going for excessive junk food, they are going for excessive fat consumption, which is leading to the disease condition. Nextly, endocrine factors. So 1% of the endocrine disorders may cause this obesity. For example, if a person is having this Cushing syndrome, or growth hormone deficiency, or excessive adipose tissue which is distributed in the lower extremities, it is most commonly seen in the males. So these are some of the endocrine factors which is leading to the condition obesity. So what are all the other factors? If you see here, mainly chronic consumption of extra calories. As I said, if any person who is having the eating habits like eating more number of junk food or eating more number of fatty foods, it will lead in the disease condition called as obesity. So consumption of diet, so periodically with which it is eaten, and amount of energy derived are all relevant to the etiology of obesity. So the person who is consuming the food, according to the consumption of the food, he has to do the work. So if he is not doing any kind of work, and if he is taking more amount of food, what will happen? Whatever the energy is generated, it is being stored in the body in the form of fat layers. So it is leading to the ultimately it is leading to the disease condition obesity. Lifestyle. So the persons who are having more sedentary lifestyle, those who sit and work all the day, so these are some of the persons, those who are having the sedentary lifestyle and those who are very low in their physical activity, it is leading to the disease condition obesity. It is leading to the disease condition. We will discuss regarding the fat tendency. So obesity, if you see, because of the dietary habits of the family, so all the persons in the family will be having obesity. So it runs frequently in families. And coming to the psychological factors, so when a person is depressed, when a person is anxiety, when a person is feeling frustrated or loneliness in the childhood, these are some of the physiological factors which are causing the obesity. So what are all the health consequences that were related to the obesity? Means, so because of a person having obesity, he may end up in diabetes mellitus, he may end up in hypertension. As I said, obesity is one of the major cause for the chronic long-term diseases. He may end up in the endocrine abnormalities. There will be cardiac vascular diseases, there will be coronary artery diseases, there will be pulmonary function impairment, there will be certain types of cancers, degeneration of joints because of the overweight which is kept on the joints, and low life expectancy. So these are some of the health consequences which were caused because of the disease condition obesity. Nextly, we will discuss regarding the assessment of obesity. So how you can assess the obesity? First, we have to assess the degree and distribution of body fat. Then you have to go for overall nutritional status. And the secondary signs of this obesity, it includes hyperthyroidism, Cushing syndrome, and diabetes mellitus. And you have to take the history of the aged assess of obesity. You have to assess the weight changes. So from which age to which age he was thin, and which age to which age he became fat. What is the occupational history? Means what kind of work he is doing. Either it is a physical activity work or physical inactivity work, and whether he is having any alcohol use or cigarette smoking, or whether he is having any psychological factors. So these are the things we should be kept in mind while we are assessing an obesity. So if you see the body weight, so here body weight is widely used here. So if you see body mass index, as I said, so if you see the Quetelet's index, weight in kg by height in meters. So if you see the normal BMI rate here, it is like 20 to 25 kg per meter square. So based on the height of the person, if a person is like 3 meters or 2.5 meters height, so ideal weight should be like 50 to 55 kgs or 75 kgs. That's what the BMI is saying here. So normal BMI for meter square, normal according to the BMI, the normal weight for meter square is like 20 to 25 kg. Nextly, Broca index. So what is this Broca index means? So height in centimeters minus 100. So for example, if you are at the height of 160 centimeters and if you have to minus 100 here. So ideally the weight will be like 60 kg. So this is the Broca index. So for example, if you are like 145 centimeters, you have to minus 100 from this 145 centimeters. So your weight should be like 45 kgs according to the height. So this is the Broca index. So nextly, we'll see regarding the Lorentz formula. So here if you see this Lorentz formula, here height minus 100 centimeters equal to height in centimeters minus 150 by 2 women or 4 men. So here the formula is like this. So height in centimeter minus 100 equal to height in centimeters minus 150 by 2 women or 4 men. So this is the formula of this Lorentz. According to the Lorentz, the formula is like height in centimeters minus 100 equal to height in centimeters minus 150 by 2 women or 4 men. Coming to the corpulence index here it is a corpulence index equal to actual weight by desirable weight. So this should not exceed 1.2 body mass index. So and Broca index is widely used. So mainly we are using the Broca index here, which is like height in centimeters minus 100. So for as we have discussed earlier, if your average weight is like 150, so 150 minus 100 equal to 50 kg. So this is the average weight of the person. In this way they are calculating. So nextly we'll discuss regarding the skin fold thickness. So if you see, it is rapid and non-invasive method mainly to assess the body fat. So measurement, it is taken from the mainly 4 sides. So they are taking from the mid triceps, they are taking from the biceps, they are taking from the subscapular and suprailiac regions. So based on that, they are giving the obesity rate. If you see here, the sum of measurement, it should be like less than 40 millimeters in boys and it should be like 50 millimeters in girls. Nextly, if you see the common sites which they are measuring the skin fold thickness, they are measuring in the mid triceps, they are measuring in the biceps and suprailiac region and mid arm circumference. So these are some of the common sites for measuring the skin fold thickness. So coming to the hazards of the obesity. So what are the hazards of obesity? Means it is mainly increasing in the morbidity and mortality of the persons. So how it is increasing morbidity means here it is the major cause for several chronic diseases such as hypertension, diabetes, gallbladder diseases and coronary artery disease. So since it is the major risk factor, there is more chances of developing these type of diseases. So it will increase the morbidity rate. As well as if you see the other diseases such as varicose veins, abdominal hernia, osteoarthritis, hips and lumbar spine and flat feet, psychological stresses. So these are some of the other factors which is leading to the morbidity in the obesity patient. And nextly, if you see, because of the other diseases that we have seen, because of the increased morbidity, there will be decrease in the life expectancy. So mainly because of the diseases such as hypertension or coronary heart diseases, it is resulting in the death of the person, and there are excess number of deaths from the renal diseases also. Coming to the prevention and control of obesity. So if you are following some health promotive measures which were including the dietary control, which were including the exercise pattern, so if you are able to begin them in our early childhood, so then we can definitely prevent and we can control the obesity. If you see, the obesity, if you want to decrease the obesity, it can be mainly achieved by the dietary changes. So whenever you are having the low calorie diet, whenever you are changing your behavior, whenever you are changing your eating pattern, when you are having some social support, then you can definitely control the obesity. So if you see dietary changes, so we have to decrease the consumption of carbohydrates and fats, so that the number of calories that we are taking will be decreased, and you have to increase the fiber content intake, and you have to consume more unrefined foods, so that the fat layers are not getting deposited. Nextly, you have to take the adequate levels of essential nutrients in the low energy diet. And if you take the food energy, it should not excess the amount of required energy for the day. For example, if you require like 360 calories per day, the amount of food that you are taking, it should not exceed more than this 360. So mainly it is requiring the modification of the patient behavior. So you should have strong motivation. You should have strong motivation to lose the weight and to maintain the ideal weight. So whenever you are having the strong motivation, so then you will not go for any kind of dietary changes. You will not eat the food excessively. Whenever you find the food, you will maintain the timing, so that the dietary habits can be achieved, and the weight of the person can be decreased. Nextly, you have to increase the physical activity. So when a person is doing more work, or when a person physical activity is more, then the consumption of the energy which is present in the body will be also automatically more. So at that time, what is happening? So whenever you are taking the calories in a lower amount, and if you are going for the physical exercise, then easily you can burn the calories here. So if you are going for 12 minutes running, you can burn the amount of 200 kilocalories. If you are going for 30 minutes swimming, then you can burn about 200 kilocalories. And if you are walking for like 1 hour, you can burn about 200 kilocalories of energy. Nextly, we have secondary treatment patterns such as control of the obesity by taking the appetite suppressing drugs. So for example, they are taking the serotonergic drugs and serotonic drugs. So if you see the success rate for these drugs, it is very low compared to the other dietary pattern and physical exercises. And we'll see what are the surgical interventions that has taken place to prevent the obesity. So mainly the surgery patterns like gastric bypass and gastroplasty and jaw writing, mainly to eliminate the eating of solid food. These are some of the useful factors which were helping in reducing the obesity in the person. Nextly, if you see health education, so it plays an important role here. So whenever you are teaching the people how to reduce their overweight and how to prevent the obesity with the diet, how to prevent the obesity with exercise, and regulation of overfeeding behavior, so these are some of the factors which can help to prevent the obesity. So one should not expect quick and even tangible results. So if you are starting your exercise today, you should not expect the results like next week. So you have to work hard for the results. You have to burn your calories. You have to maintain your dietary patterns. You have to maintain your regular exercise. Then only you will have the accepting results. So you have to encourage the people to check their regular weight. So whenever they are checking their weight regularly, they will understand to be taken place, and they will modify their behavior. And it is our responsibility as a community health nurse or as a health personnel to educate the parents, so to identify the obese children and to teach the parents to find out the way to prevent the obesity in children. So these are the factors which were associated with this disease, obesity. So with this, I would like to conclude the session. So if you like the content, please like, share and subscribe the channel. And if you have any suggestions for me regarding my teaching, you can drop them in the comment box. Thank you for watching.